his presentation. Thank you.
Good morning, ladies and gentlemen. And I thank the selecting committee as well as our chair to give me this opportunity to present this work. Our group, as well as Dr. Lee from Lee Pharmaceutical Company, working in the last couple of years. So this, I agree with Joseph, is indeed pretty exciting for my group as well as the Lee Pharmaceutical Company as well. So what we do in this study, we isolate one of the compounds, the protein from snake venom, and we think that is important through the antagonist, one of the platelet protein we call the GPMB complex. So why this is important? As we all know, so hopefully I could find the laser point. Is this one? Yep. So as we all know, once we get injured, so once the subendothelial matrix protein exposed to the blood streams, so that means once no matter the physical trauma or rupture of our plaque of atherosclerotic lesion, so subendothelial matrix protein, such as collagen, will expose to the bloodstream. But the platelet cannot distinguish these two events. They think this problem is bleeding, so they want to come there and stop the bleeding. So this action we call the platelet adhesion and aggregation at the site of injury, which is good. Physiologically, it's a stop bleeding. But if it occurs as a site of atherosclerotic lesion area, that could cause a heart attack and a stroke. That's based on which vessel be targeted. If the targeted coronary artery, so it could lead into heart attack. If occurs in the brain vessels, that will lead into stroke. So, so this is usually, once we pass through the teenager, we will develop atherosclerosis lesion. So most of our audience probably already have this lesion in our vessels. But usually it does not cause the problem. Most of the time, the doctor, even ourselves, we're not able to identify them. Only this causes major issues, such as block significant of the blood flowing to the heart. We will be able to feel the difference. So why this drug is important? Once the platelet come to the site of the injury, particularly at high shear stress, such as occurs in the coronary artery, so this need one interaction, that is platelet surface GPMB complex, this protein bonding to von Willebrand factor, so that's anchored to the vessel wall. So therefore, platelets through the GPMB complex, then bonding to von Willebrand factor that's anchored to the collagen, which is on the vessel wall. So this initiate, actually this is the first step to recruit the platelet to the site of the injury. Seems to me this mouse does not move as fast as my mouse. So this interaction, so therefore it's important if we're able to stop this protein interaction with vessel wall, we're able to stop the platelet recruitment at the early stage. But then there is a question, why so far we have not able to develop the drug attack this? That we not fully understood, but to my understanding, many of my colleagues try to do that, but none of them able to reach to the clinical trial. Several strategies could target this protein. One is use monoclonal antibody against the GPMB complex, similar to what we do with GP2B3A. That's already in the market, like reapproved integranin. This type of the drug already target another protein that stop platelet bonding one to another. But this protein, antagonist target GPMB complex, will target the early stage, that's the platelet vessel wall interaction. So the previously that's other antagonists not able to be developed to the clinical trial this stage. That's a problem because of this protein very sensitive to the triggerant. If you not treat them properly, you may cause the side effect, such as even problem cause the platelet activation. That's problem opposite to our interest. So we isolate this protein from this snake venoms snake. So we also call the 100 pass this snake. Seems to me pretty poisoning. Obviously, it's not comfortable if we bite by them. Yeah, but we in these compounds is not the whole venom. It's isolate one of very specific compounds we call the Anfibatide. So we through the several purification pathway, actually 3 chromatography pathway, including use a monoclonal antibody specifically to bonding to this protein to isolate them. You could see this compound is extremely pure. We could even use these compounds to the X-ray crystallography. So it's very pure from this snake venom. So this is GP1B complex. It's usually bonding to von Willebrand factor mediated platelet recruitment to the site of injury, either the physical trauma or the rupture of atherosclerotic lesion. You could see this snake venom bonding to this area, so therefore able to block this von Willebrand factor A1 domain bonding. So therefore, this is a mechanism able to stop platelet recruitment, to stop this heart attack and stroke. We test the function of this Anfibatide, this compounds from this snake venom. We found it's able to stop platelet from the mouse recruit to for the platelet recruitment, platelet aggregation. It's also able to stop human platelet recruitment. We test that, first test that in vivo in the mouse in the 2 different intravitro microscopy model. This model, first when I was a postdoc fellow in Dr. Denisa Wagner's group in Harvard Medical School, it's more than 10 years ago. Another system was developed by Dr. Bruce Fury in Harvard Medical School as well. So we have these 2 complementary intravitro microscopy. We are able to exactly monitor how this snake venom compounds inhibit the platelet recruitment at the site of the vessel injury. As we could see from here, this significantly inhibit the platelet aggregation, inhibit thrombus formation. In this model, we found that's almost flat. So after give the compounds to these mice. So we also test the human plasma, human blood in vitro in this perfusion chamber, which is mimic this thrombotic events in vivo. As you can see from here, this Anfibatide is almost completely inhibit human platelet thrombus formation. And even more interestingly, so once the thrombus forms, because once the patient sees the doctor, they already has thrombotic events. They has chest pain or different thrombotic symptoms. So that means the thrombus already formed. So we want to know, once the thrombus already formed, what effect of this Anfibatide. We found here, we first let the thrombus formed. So then, once we give this Anfibatide, you could see the thrombus able to be dissolved. Although the mechanistic not fully understood, but we have several explanations this compound may do. So then we move to the clinical trial 1. We recruit 94 volunteers. Most of them are medical students, undergraduate medical students. So what we see that once we give this compounds to these volunteers, the compounds able to appear in the blood, and also that's able to bonding to platelet GP1B complex. And we found that give this compound, at least at this dose, that's able to bonding to platelet GP1B complex. That means has a functional. So we found there is no significant decrease of platelet count, as Joseph mentioned. We pursue the minimum the side effect. So lose platelet and also cause bleeding disorders is currently many of these antithrombotic drug, the side effect of them. So we found these compounds does not decrease platelet count and also does not prolong the bleeding time of these volunteers. I cannot say they are patients, they are relatively healthy graduate students. So we did not see any serious side effect, and we feel this compounds maybe is a safe and a potent antiplatelet reagent, has the important potential for the future antithrombotic therapy. So this work was mainly done by Shi Lei, she's in the audience, and also my technician, Rohaman Adli, as well as my visiting postdoctoral fellows from China. So they all contribute for this work. And this work cannot be done without this company, Li Pharmaceutical Company, Dr. Li, and without he provides this compound for us, we cannot to generate this data to share with you. So I thank you for your patience and attend.